Brooks for Albany State.
Thank you, Mr. Chairman. As my colleagues have talked about, the public health crisis that the heroin and opioid devastation creates, many may not realize that there was a crisis in my home state of Indiana. In Scott County, a rural county in southern Indiana, the HIV/AIDS rates exploded a little over a year ago as a result of IV drug use. And while the spotlight was on Scott County for a period of time, we know this public health crisis happens all across our country. In headlines and more sadly in obituaries in our papers day in and day out. We see rising rates of child welfare cases due largely to the neglect of children from drug-addicted parents, large number of infants being born addicted to opioids, and cycles of recovery, relapse, and addiction. But the epidemic didn't happen overnight. Medical providers and healthcare workers say that much of the crisis began with the overprescription of opioids. Certainly there is a medical need for pain medications and opioids, but in this country we've developed a culture of overprescription that is built on patients' expectations and providers' lack of awareness and failure to address this overprescription of these types of medications, which is a major part of the epidemic. What I would say the root from the outset perpetuates the cycle of addiction in our communities. So I urge my colleagues to support this legislation, which includes, beginning with Section 101, the Task Force on Pain Management, which establishes this comprehensive task force comprised of representatives from the relevant federal agencies, as well as expert physicians, recovery specialists, hospitals, dentists, pharmacists, all sorts of groups, health, mental health, and addiction treatment communities, because we must get to the root of this problem. I believe this bill does this. It's going to take all of us working together, and urge my colleagues to support and move forward and give some families some hope. Thank you. I yield back.